Hey guys, Dr. John Schaefer here. Today we're going to do a little bit of a follow-up video to a video that I made a couple years ago. And that is what to do if you fail the NPTE. Honestly, God, I don't really think about the NPTE very much at all anymore. The only times I think about it are when it pops up each year, because I get a spike in views for my video that I made previously, as well as some people reaching out saying, "Hey, I was in a similar position that you were in. What advice, what words of encouragement do you have?" So I feel like that first video covered a lot of that, honestly, just steps related to the exam, how to bounce back. This video is going to be a little bit different because I want to just give you perspective on what's changed, what's happened in the last 2 years. Because regardless of what happens initially with that exam, really doesn't matter because you're going to go on, you're going to do great things with your degree, with your license, all that good stuff, regardless of how long it takes you to get there. So I don't really have many notes for this video. I'm just going to talk to you as a friend, as a colleague, because this is important to me. This is the stuff I enjoy because I felt like that going throughout PT school, I was never the best test taker. I was never a superstar student. I felt like I always had to work very hard compared to maybe some of my peers. And even then, I wasn't always getting the results that I wanted. So fast forward to today, and everything that I say is just in a lens of perspective because I want to inspire you. I want to give you hope, and I want you to know that, you know, bigger things, I guess, lie ahead after this exam. It's simply a little bump in the road if you didn't pass. So, following taking the NPT, failing the first time, studied hard, got some additional resources, and then I ended up passing in July. And then following that, I was accepted into a residency program. Through that residency program, I had the chance to get some excellent mentorship, had opportunities to teach at several universities, both in a lab setting as well as lecturing. And none of those students, no one asked, "Hey, did you pass MPT the first time?" No one cares. No one knows. All they know is that you're a licensed PT at that point. If people bring up that they're struggling, I'm happy to jump in and say, "Hey, I was there too." Um, and I feel like that's another reason I'm making this video is because not enough people talk about the failure of not passing MPT because when test results come out, everyone's posting excited that, hey, I passed MPT. It's never the people who don't pass aren't as vocal typically. So went throughout the residency program, was got uh completed that. There's all kinds of tests, examinations throughout that process. And then I studied for and passed the OCS exam, which is a board certification in orthopedics. So that's like a 7 hour exam. And I was absolutely mortified for that because if I didn't pass the MPT on the first time, how in the world was I supposed to pass the OCS? Um, but just using different strategies, having more confidence in myself. I don't really know what changed, but I ended up scoring in the top 5% of OCS test takers, which I was extremely proud of. Because I've had so much test anxiety in the past and things like that. I read a book, it was called Make It Stick, and that was extremely helpful in just going throughout the test taking process, the studying process for a big test. Just gave me a lot of different insight because I think so often as I went throughout PT school, even studying for the MPT, I was trying to memorize rather than actually apply. So a lot of it for me was, okay, how long can I sit down? How long can I study this information rather than, okay, can I connect some dots and make lasting connections to where I'm not just memorizing and then I'm able to pull some of this information forward. So past the OCS, super exciting. But I don't actually practice in the orthopedic setting right now. I'm doing home health. There's just a little bit more flexibility in terms of scheduling. Pay is a lot better than what it would likely be in the outpatient setting. And then I also have an online therapy company that I've been growing over the last 2 years since graduation, focused on treating endurance athletes with knee pain. So I've been very active in the online space over the last 3, 4 years at this point. And again, throughout all of these opportunities, all the patients I'm working with through my own business as well as through the home health patients. No one knows if you pass NPTE. No one cares. Even in terms of like board certifications, I'm board certified in orthopedics. I have my CSCS as well. No one really cares. It's how you're able to connect with people. It's really a matter of if you're able to communicate and help people get better. No one, cares too much about your credentials or how you got there. So I think, just other lessons that I'm learning is you can do really whatever you want to do in terms of what you want to accomplish with your degree. If you want to go your own direction, in terms of seeing patients on your own, if you want to work in specific settings or bounce around, it doesn't matter. You can create your own journey. You can create your own path in terms of what you want to do as a physical therapist. I think a lot of us feel like we're tied down to a specific route, pass this exam, get this job, get this certification. But really, my biggest piece of advice to 2 years removed would be just follow your passions in terms of what sorts of things interest you. If that's working with a specific population, learn more about that population. If it's, getting more into teaching or more into different roles outside of direct patient care, follow that. If it's more on the side of business development, entrepreneurship, buy a course or watch YouTube videos. There's so much information about how to accomplish different goals within the field that don't ever feel like you're tied down to one specific job or one specific position because there's so many opportunities and so many people willing to help you create those unique situations where you're feeling very fulfilled in your work. So, like I said, it feels crazy talking about it now because in the moment I was absolutely crushed and I didn't think that there was ever going to be a point where I was practicing as a PT. I remember I was sitting in my car. Um, in Emporia, Kansas. It was during one of my clinic rotations, thinking, okay, I don't think I'm going to be a physical therapist. I don't think I want to do this. I don't think, it's right for me. Obviously, if I can't pass this exam, it's not going to happen. But a few months went by, I passed the exam, and now I'm board certified, have my own practice virtually. I'm doing well in person, with a lot of flexibility, making good money. Um, so, there is a light at the end of the tunnel, and I just want you to know that whatever you're feeling in the moment right now in regards to the exam, it's going to pass and you're going to forget about it in probably 6 months after you take it. And then, unless you're making videos about it and people are reaching out to you, you're never going to think about it again. So, hopefully, this was encouraging. Because I know that, like I said earlier, people don't always talk about the times where things aren't going well. And if there's any way that I can support you, if there's any way that, I can help you get over this hump, more than happy to do so. And if nothing else, just take this as words of encouragement, knowing that things will get better and this is going to be a distant memory in no time. So I'm going to make some more videos just about topics within PT, things that I've learned early on in my career, just ways that I can help you as a student or you as a physical therapist make the most out of your degree, find opportunities that are unique, and keep moving forward. So hopefully this was helpful. If you have any questions, feel free to drop them in the comments and I'm happy to answer.